Welcome to the deep dive. We've put this together especially for you, looking at the materials you sent over about healthcare.
Yeah, it's an interesting set. We've got stuff on achieving, high standards of quality and safety, mentioning JCI and NABH.
Right, those accreditation bodies. And then there's the other side, the really practical stuff about actually getting care, specifically healthcare pre-authorization.
Exactly. It's kind of the big picture system stuff and then the nuts and bolts of the patient journey.
So our mission here is to unpack all that, pull out the key info, see how it connects, and, well, hopefully help you feel better equipped to deal with the healthcare landscape.
Definitely. We'll see if we can uncover some maybe surprising bits and practical takeaways along the way.
Okay, let's start big then. Setting the standard. What's the deal with healthcare quality and safety on a global scale? Why is it so critical?
Well, it's absolutely fundamental, isn't it? We're talking about ensuring the best outcomes, minimizing harm. It's not just nice to have. Your sources stress it's essential. Rigorous standards are needed.
In Joint Commission International, JCI, keeps popping up in the materials as a major global player here.
Yes, they're definitely a recognized leader. The sources describe their mission as enabling and also affirming the highest standards for quality and safety. And importantly, for everyone.
For everyone, everywhere sort of thing.
That seems to be the goal. They're working towards safer care globally. The info mentions they operate in, over 70 countries?
Yeah, across Asia, Europe, the Middle East, Africa, Latin America. That's a lot.
It really is. It shows how widespread this push for standardized quality is. And they've accredited or certified over 1,000 programs.
Wow.
Supported by something like 600 experts worldwide. So yeah, significant influence.
And it's not just the global players. The sources also brought up NABH. That's the National Accreditation Board for Hospitals and Healthcare Providers in India, right?
Exactly. Part of the Quality Council of India. It shows that this isn't just, a top-down global thing. Countries are setting up their own accreditation systems too, tailored maybe to local needs, but with that same core goal, quality and safety.
Okay, so how does a hospital actually, work with JCI? How do they meet these standards? Is it just a checklist?
It's definitely more than a checklist. The sources say it starts with JCI's international standards, and they're described as rigorous. That's the foundation. Hospitals get evaluated against these.
Covering everything.
Pretty much. Patient care, how the organization is run, all sorts of aspects.
I saw something called the International Patient Safety Goals mentioned too. Are those part of it?
Oh, yeah, a key part. Those goals are very specific, designed to tackle known problem areas where patients are most at risk, things hospitals really need to focus on to prevent harm.
Makes sense. And JCI doesn't just hand over the standards and walk away. They offer help.
Right. It's more of an ecosystem. They've got accreditation programs, obviously, for hospitals, academic centers, et cetera, but also certification programs, things like clinical care pathways, even newer areas like telehealth, and interestingly, healthcare sustainability.
Sustainability?
Yeah.
Huh. That's evolving.
Yeah, it shows they're adapting. And then there are advisory services to help hospitals prepare, improve infection control, medication safety, emergency plans, plus training, education.
And you mentioned high reliability tools. What's that about?
That's a really interesting concept that came up. It's about borrowing ideas from industries like aviation, where mistakes can be catastrophic. Building systems and processes that are incredibly resistant to failure, basically minimizing human error through better system design.
So making it hard to do the wrong thing and easy to do the right thing.
Exactly. Focusing on the how of consistent quality, not just the what.
Okay, so hospitals go through all this.
Yeah.
It sounds like a lot of work. What's the payoff? What are the benefits, according to the sources? For the hospital? For us as patients?
That's the key question, isn't it? The sources mentioned some really interesting benefits, some maybe unexpected ones from testimonials.
Like what?
Well, one hospital president CEO apparently said the JCI process was amazing for team building. Like it really brought staff together, improved coordination, communication.
Really? Team building?
Yes.
You think compliance, paperwork?
I know. But it seems the intense shared effort needed to meet the standards really forged stronger teams, which, has to be good for patient care in the end.
Yeah, that does make sense, actually.
Other benefits mentioned are more what you might expect, a competitive edge, boosting community confidence, because accreditation is like a seal of quality.
Sure, you see the certificate on the wall.
Right. And improved risk management, naturally. But a big one highlighted was strengthening patient safety efforts to create a genuine culture of safety.
So not just policies, but how people actually think and act day to day.
Precisely. Embedding it in the hospital's DNA, so to speak.
Yeah.
That feels really important.
Yeah, that cultural piece sounds huge. And you said JCI keeps evolving.
Yeah, the sources mention things like patient safety pathways, a continuous accreditation model, so not just a big survey every few years, and that sustainability certification shows they're not standing still.
Okay, so that's the system level, the big push for quality. Let's switch gears now to something much more personal, I guess.
Yes.
Pre-authorization, something patients run into directly.
Definitely. A very different scale, but super important for the individual experience. So pre-authorization or pre-approval. It's basically getting the official okay from your insurance company or TPA before you have certain types of medical care.
Yeah, and let's be honest, it can often feel like just more bureaucracy, another hoop to jump through. Why do the sources say it's actually important for the patient?
It's interesting how they frame it. One source explicitly said, think of it as not red tape, but your confirmation that insurance support is ready.
Okay, so shifting the perspective.
Yeah. The main point is it confirms your coverage before the treatment happens. This helps you avoid nasty surprises later, like finding out something isn't covered or facing huge unexpected bills. It's about financial peace of mind, really.
So it confirms what? Three main things? Coverage, cost approval, and...
Exactly, according to the sources. 1, is this specific treatment actually covered by your plan? 2, has the hospital's estimated costs been reviewed and okayed, at least partially? And 3, if it applies, are you eligible for cashless service at this hospital? It clarifies the money side up front.
Got it. When do you typically need this? Not for just seeing your GP, right?
No, usually not for routine stuff. The sources point towards planned procedures, especially ones that are, costly.
Like surgeries.
Yeah, examples given were planned surgeries, hernia repair, gallbladder removal, that sort of thing. Also, expensive tests like MRIs or therapies like chemotherapy, admissions to ICU or special wards often need it too, and elective procedures, even if they're medically necessary.
Okay, so mostly for planned, significant interventions. What about emergencies? If you're rushed to the hospital, you can't exactly get pre-approval.
Good question. The sources are clear on this. Genuine emergencies usually bypass the initial pre-authorization step, so treatment isn't delayed. But, and this is crucial, you typically need to inform your insurer within a set time, often 24 hours, after admission.
So the notification is still key, even if it's after the fact.
Yes, absolutely. So the insurance process can start, possibly for what they call retrospective approval.
That's a vital distinction.
Uh-huh.
Okay, so if you do need pre-authorization for something planned, what do you need to provide? What paperwork?
The usual list, based on the sources, includes the doctor's prescription explaining why you need the treatment and their initial diagnosis.
Right.
Then an estimate from the hospital, the treatment plan and projected costs, copies of your ID and insurance card, obviously, and a pre-authorization form, which often the hospital's insurance desk helps fill out and submit.
Oh, that's helpful if the hospital assists.
Definitely takes some burden off the patient.
How long does this whole approval thing usually take? Are we talking days, weeks?
Generally faster than a week, thankfully. Once the hospital submits the request, the sources suggest the TPA or insurer usually processes it within, say, 4 to 24 hours.
Oh, okay. That's pretty quick for insurance.
Relatively, yeah. You often get notified by SMS or email, sometimes via the hospital desk.
But what if it gets delayed? What if it takes longer than 24 hours and your surgery is scheduled?
That's the tricky part. If the approval doesn't come through in time, the sources warn you might have to pay the hospital yourself first and then claim reimbursement from the insurer later.
Which is exactly what you're trying to avoid with pre-authorization.
Precisely. It highlights why understanding the timelines and potential hiccups is so important.
Okay, so knowing all that, how can you, the listener, navigate this better? The sources had some do's, like a checklist for success.
Yeah, those do's are really practical. First up, do find out early if pre-auth is needed. Ask your doctor, ask your insurer. Don't assume.
Be proactive. Makes sense.
Second, do ask for detailed guidelines. What forms? What steps? What documents exactly? Get it all clear up front to avoid delays.
Right. Don't want to miss anything.
Third, do ask about the time frame. How long should it take? And crucially, what happens if it's delayed? Especially if things are time-sensitive. Manage those expectations.
Okay. And what about the approval itself?
Good point. Do clarify the coverage details once approved. Does it cover everything? Are there limits on room rent or specific items? And do understand the denial process. What if they say no? Can you appeal? How?
Always good to know your options.
Absolutely. And fifth, This is critical. Do keep records of everything. Every call, who you spoke to, when, what they said. Keep copies of all forms, emails, letters. Your paper trail is your safety net.
That sounds like solid advice for any insurance dealing,
It
honest.
really is. Also, do follow up if approval is pending. Don't just wait passively, especially if a date is approaching. Check in with the insurer. Keep the hospital in the loop.
Okay. And anything else?
Just reinforcing that emergency point. Do understand the specific rules for retrospective approval, the timeline for getting documents in after the emergency.
Got it. So it really boils down to asking questions, getting clarity, and keeping good records.
Pretty much. Proactive communication and documentation are key. It's your right to understand how it works.
So we've talked about the big system stuff, accreditation driving quality, and this very individual step of pre-authorization. How do they connect? Are they related?
I think they are, definitely. They're like two different lenses looking at the goal of a better healthcare experience. Accreditation works from the inside out, right? Building strong systems, safe processes, a quality culture within the hospital itself.
Making the place you go fundamentally better.
Exactly. And pre-authorization is about the patient navigating their way into that system smoothly, at least from a financial and administrative perspective. And you could argue that a hospital that's really committed to quality, maybe one that's JCI or NABH accredited, is likely to have better internal processes overall. That might translate into a more efficient, less confusing pre-authorization process for patients too.
So a well-run ship clinically might also be a well-run ship administratively.
It's possible, yeah. The dedication to process and standards might carry over. The sources even mentioned consultancies, like Supremedic Consultancy, that help hospitals get ready for NABH accreditation, improve operations.
Right, helping them build that quality foundation.
Exactly. So these consultants are part of that ecosystem, helping hospitals meet the standards, which indirectly should improve the patient experience at multiple points, maybe even including admin processes like pre-auth.
I see. So it's all interconnected in this complex web of healthcare?
It really is. And when you think about the other topics mentioned briefly in the source materials, things like healthcare financing, managing chronic diseases, new technology, specialized care, having both robust quality standards and clear patient access processes like pre-auth are crucial pieces for making the whole system work better for everyone.
It definitely ties it together. Understanding the quality push and the practical steps like pre-authorization seems really empowering for navigating it all.
Totally agree. It gives you context and practical tools.
So to wrap up our deep dive today, we've seen how accreditation bodies like JCI and NABH play this huge role in setting standards for quality and safety. That's the system level. And we've looked at pre-authorization as a really vital practical step for you as a patient to get that financial clarity and reduce stress when you need care. Knowing about both helps you manage your healthcare journey.
Absolutely. Informed navigation makes a big difference.
And here's something to maybe mull over. We've talked about these big organizations pushing for standards and individuals like you navigating things like pre-auth forms. How might your own experiences, maybe the frustrations or the smooth processes you encounter when dealing with these requirements, how might that feed back into or even influence that bigger system-wide drive for quality? What does that connection between individual interaction and systemic goals tell us about maybe our shared role in making healthcare better?
Definitely some food for thought there.
Thank you so much for joining us for this deep dive. We really hope you found it useful.